I'm Tori Botleone, and I'm going to be doing student number 3, and I'm starting with a head of table thumb spinous push for a left rotation restriction of T1. So I start with the patient prone, and I'm going to rotate their head to the left, to their right, and then my stabilization hand is my hypothenar of my left hand, just behind the ear, and then I use my thumb and I locate my T1, and my tissue pull is P to A on the traps, L to M, and then I get my arm perpendicular to the floor, parallel with the floor, perpendicular to my contact, and then my line of drive is going to be lateral to medial or left to right. I'm doing the prone index pillar push ipsilateral for a left rotation restriction of C5. So what I'm going to do is I'm going to first locate C5, and then I'm going to take a P to A medial to lateral tissue pull with my lateral aspect of my right index finger. I'm going to take this left ear and stabilize with the thenar of my left hand, and then I'm going to go ahead and my line of drive is going to be P to A, S to I, and a little bit of lateral to medial. Supine anterior thoracic contralateral for a right rotation restriction of T6. So I go ahead and I have the contact side hand on the bottom. I roll my patient over and then locate T6. I'm going to use the thenar of my right hand to contact the left TBP. And so I contact the left TBP and then roll over. My stabilization hand is my left calcaneus, left palm. And then I'm going to have you turn your heads that way. And then I would just P to A, I to S for the tissue pull and the line of correction. This is for me. Okay, I'm doing the seated index pillar push for a left rotation restriction of C5. So I have my patient seated, and I'm going to palpate for C5. I'm going to contact with the lateral aspect of my index finger, my right index finger, on the right articular pillar of C5. I'm stabilizing just off, with my palm, right thenar on the mastoid, my hands down the spine to stabilize, and I'm going to go ahead and tissue pull. I'm going to laterally flex and then rotate, and then I would thrust P to A, S to I, a little bit lateral to medial. Okay, so I'm doing a seated hypothenar mastoid occiput lift with a left lateral flexion restriction. And I'm going to have my patient turn their head to the right, and then I'm going to contact the left mastoid and then stabilize with the right, and then I'm going to go ahead and pull my shoulders back and straighten my chest while I'm doing a scooping motion like that, and that's going to be tissue pull of P to A, I to S, and that's going to be line of correction of L to, lateral to medial and I to S.